I saw that you also got deployed to Afghanistan, and I guess where did that fall into place for your plan after PT school?
Yeah, so that happened. I was a reasonably new graduate. I deployed uh, in the fall of 2008. So I was out of school for a year when I went to Afghanistan. So I was going out of Travis Air Force Base. So I showed up to Afghanistan. I'm the clinic chief. 1 year outside of school, I'm supervising two PTAs. I'm the only physical therapist at the time, and uh, and on top of it, in Afghanistan, you're kind of alone. You're on an island. There was no other PTs that I could talk to. My PT colleagues back in the States were, on a 12-hour time difference. So when I was awake and I needed help with the patient, they were all asleep. I think that really became an interesting flashpoint in my career, just understanding like, wow, like I need to be able to stand on my own, as a doctorally trained musculoskeletal expert, and be able to handle, everything that walks through my door.
Sure.
And, the responsibilities that we had there. So when I got there, our family practice was getting slammed. So primary care was getting slammed. They had a lot of patients. We had a lot of inpatients as well. So I was with that, we had what's called sick calls. So essentially patients would come in, they would say they're here for whatever condition. I would go over to family practice and I would go through the list of people. And if they were there for back pain or knee pain or shoulder pain or whatever else, I would pluck them off the list. I would see them in physical therapy, and then I was essentially acting as a family practice or primary care provider in that way. So I would prescribe them the medications if need be. I would order them the imaging if need be. I would take care of their entire case. And with that, I was averaging 25 patients a day. For me solely, that doesn't include the patients we were supervising from the PTA standpoint. And of those 25 patients a day, we averaged 20 new evals a day and 5 follow-ups a day. So the majority of patients that we saw, we would only ever see once. So we had to make sure that if they needed medications, they had medications. If they needed a brace, if they needed, any kind of equipment, if they needed imaging, if they needed to not be in theater for whatever reason. We had a couple of people that came in with broken legs. Well, you can't stay in theater with broken legs. You can't run for cover and protect yourself. So I was making all of those decisions about whether they would stay in theater or not. And if they left theater, I was responsible for getting the patient admitted so that they could, transfer out. So it was a busy time. We would start seeing patients around 6 a.m. and I would just continue to see patients until there were no more patients left. So the average workday was about 12 hours, but that was 12 hours of patient care. And then I would usually write notes afterwards, because again, you have 20 evals and 5 follow-ups a day. I would just write notes until I fell asleep at 10, 11 o'clock. I'd fall asleep on my plinth in my office. So the same place I was evaluating patients, I would just sleep on my plinth. I'd wake up in the morning and there was a shower right beside my office. I'd hop in the shower, and frankly, there were days that I didn't leave, a 20 square foot area, just because everything was right there where I needed it. So it was exciting times.
I was going to say, any PT out there who's saying that they're burnt out, listen to the story and just reevaluate how you feel about your clinic.